broadcast center in Los Angeles. This is KCAL 9 News at 8.
The surge of COVID-19 cases is putting an extreme burden on hospitals right now, already bursting at the seams with patients.
That's right. Health officials keep sounding the alarm, but many are not heeding their warnings, we're told. KCAL 9's Michelle Gilly spoke to some providers who have been overwhelmed.
I round a lot, and the word I get is I'm tired. That's the number one word, fatigue. They're all fatigued.
It's being called COVID 3.0. Riverside University Medical Center is now seeing its third wave of coronavirus patients. Doctors, nurses, and healthcare workers are several months into battling the pandemic. Resources like traveling nurses are more scarce than they once were.
Now we're on to round 3. And this one is scary because the public is not hearing it anymore. They're tired. The nurses are tired. We don't know how long this is going to go on. There's not as many healthcare professionals as there was the first round because everybody was in it for the, to get through it.
Meantime, COVID cases have quadrupled this past week at Chapman Global Medical Center. But at this small community hospital in Orange, the caseload doesn't compare to the larger hospitals in areas where COVID is more widespread.
Doing a much better job of treating patients. So our ICU volume has gone down tremendously, about 300%.
Former ICU nurse Matthew Whaley is now the CEO of Chapman Global and South Coast Global Medical Centers. When the pandemic began, Whaley says 60% of his ICU nurses at Chapman Global went out on leave because of the fear of COVID. But that's all changed.
Our morale is pretty great. With the second surge, I was really concerned that we were going to have a dropping out or a falling out of nurses. But so far, that's not the case. Everybody's staying strong and working really hard.
In Orange, Michelle Gilly, KCAL 9 News.